Our Champions of Care reporter, Lisa Peers, visits an Oakwood-affiliated ophthalmologist to understand how diabetes affects eye health.
Thanks, Mary. We're in the Dearborn offices of Dr. Ashish Tiwari, an Oakwood-affiliated ophthalmologist and retina specialist. Dr. Tiwari is also the Director of Retina Services at Kresge Eye Institute. He'll be talking about how diabetes impacts eyesight and what someone with diabetes can do to preserve their vision and maintain good eye health.
Diabetes is a disease of blood vessels. It affects blood vessels throughout your body. It affects your heart, your kidneys, your brain, also your fingers and toes. Well, you have those same small blood vessels in your eyes. Diabetic retinopathy relates to bleeding and swelling in the back of the eye. So the best analogy is that the blood vessels that are in the back of the eye, that are in the retina, are like the pipes in your basement. So those pipes can sometimes spring a leak. And the main goal in trying to treat diabetic retinopathy is to try to seal those leaks. So it's really important that if those leaks are found early enough, the less damage you'll have. Patients can typically have blurry vision, or in some cases may not have any change in vision at all. And that really underscores the need to get in for a yearly exam, because if the problem is caught early enough, something can be done about it. If it's caught at a later stage, it's hard to reverse a lot of the changes from diabetes. The main way we try to seal these leaks is with laser treatment. And this is a fairly straightforward procedure that's done right in the office. We do some testing in the office that allows us to find out where these blood vessels are leaking from, and then using laser that's focused exactly on those leaking spots, we seal that area. In some cases, that's enough to preserve a patient's vision. In some cases where there is still some residual swelling that's there, we have to do some other things, which can involve putting medicine in the eye. In some cases, when diabetic retinopathy progresses and you get a lot more bleeding in the back of the eye, we oftentimes have to do surgery to try to remove the blood from inside of the eye. And once that blood is removed, we can do laser treatment to try to seal again those leaking areas. The most important statistic is that the longer you have diabetes, the higher risk you have of developing diabetic retinopathy. But with good blood sugar control, there are many people who have perfect vision even into their later ages of life. If diabetic retinopathy goes untreated, there is a high risk for permanent loss of vision. And especially when this impacts people at a younger age, this can have long-lasting effects. The most important thing that people can do is obviously control blood sugar, but then also get annual eye exams. There's been an increasing amount of patients with diabetes and complications like diabetic retinopathy in the last few years. And I think one of the major reasons for that is the increase in obesity and really the change in diet and fitness. And I think that there's a lot of effort that's being put to try to decrease the number of patients who have diabetic retinopathy, or really try to manage the ones that do have diabetes, and the ability to try to preserve their vision and give them good sight for years to come is gratifying. I absolutely love it.
As we wrap up our diabetes program, I want to thank endocrinologist Dr. Opada Azulhali, ophthalmologist Dr. Ashish Tiwari, and podiatrist Dr. Debbie Woody. To find out more about these physicians, visit oakwood.org or call us at 1-800-543-WELL. Thank you for watching Champions of Care. We'll see you next time.